Hi everyone. So, you remember me, I'm sure, from being in the clinic. We kind of covered just some of the topics of your pain, and we went over some interventions we can use, including the mirror box. So, we're just going to review that now, and I'm going to give you some progressions that you can use at home, along with building your own mirror box, which there are resources online on the NOI website. So just go ahead and search that, and you'll be able to create one of these in no time. So for what you're going to do with that, I have my assistant here, Corey, who's going to be you, all right? So first, number one importance, you can see Corey here, he has a watch on his arm. We want to make our arms look exactly the same as much as we possibly can. So this is a simple solution. Take the watch off. If you have a tattoo or something, you might have to just wear gloves every time you perform the mirror box therapy. So we're going to start. Corey's affected arm, or the more painful arm, is his left. He's going to put that in the box. And the right arm, he really has no issues with using it. So that's going to be his one that's outside the box, and he's going to be able to look at the mirror, and it actually appears that his right arm is his left. And this will help the brain kind of deal with the pain, and will gradually increase the ability of the arm to perform movements that were at first painful. So how we start, you're really painful, everything hurts, touch hurts. We might just start with, you might need a partner to just kind of lightly touch your arm. And we want Corey to be looking in the mirror the whole time so he can see this. And what you might hear is that he feels it on his left side. There might be tingling. How do you feel about this, Corey?
I feel slight tingles on my left hand in similar spots where you're touching my right.
Okay. Good. And this is completely normal. Okay. Now, if it becomes painful, Corey needs to make this known. Okay. So if it becomes painful, I want to stop immediately. All right. And Corey's going to let you know, or you will let yourself know, really, when the pain goes away. If it goes away immediately, that's great. We'll let Corey rest for a little bit, and we'll return to it again. Okay, just trying to desensitize his left hand. And so, if the pain does not go away, that can be a problem. And what we'll want to do is just kind of stop the exercise for the day, and we'll try again tomorrow. Okay, let everything calm down, give it a lot of time, and we'll see what we can do tomorrow. We're just trying to do this gradually. It could take a long time. So as things are starting to progress, then we want the patient, or you, in this case Corey, to just do the movements on his own. So let's start with some simple, just turning your hand up and down, Corey, all the while looking at the mirror. And now your arm inside the box is not moving at all. Okay? How does this feel?
Makes my left hand feel like it wants to reciprocate this motion.
Yes, exactly. And this is good, but at this point, we do not want to reciprocate the motion. Just the thought of the reciprocation can make it painful. If it does become painful, the same rules I just spoke about apply. Okay, stop, see how it goes, assess it, and then try again if the pain goes away immediately. So you can do all kinds of movements: wrist flexion, extension, up and down, touch fingers together. The important thing is you're always watching yourself in the mirror while you do it, okay? So once you're able to do that, and there's no pain with it, then we're going to start actually mirroring the motions that you're doing out here with your hand in the box, okay? So now, Corey, I want you to touch your fingers, each one, in the box. Go as far as you can where it's not painful. It doesn't matter if you don't touch your fingers together, okay? Good. It's just that gradual exposure, and this mirror can often help the brain realize that, movement isn't causing you pain. There's no tissue damage there. Good, good. So, here we go. We're progressing again. Everything's going well. We can now do full range of motion in the box, right? That's what you're working towards in the same movements, all types of movements, all right? And as you go along, you can do different orientations, move the wrist in more complex ways. Exactly. And we want to be able to mirror all of this eventually in the box, right, with the full range of motion. Now this is going to take a long time. This is a short video. You're progressing this on your own as we go. Another thing is even manipulating different objects, okay? So we have to have the same object, put one outside the box, one in the box. And Corey or you can just play with this outside the box, trying to do the exact same things, feeling the different sensations of the object, squeezing the object, and mirroring that with his arm inside the box. Okay? So that's a brief overview of what you'll kind of be doing over the next month, 2 months. It'll be different for each patient, for each person, and how long the desensitization, how long it takes to really facilitate the processes where now you can move your affected limb without the pain, okay? And so the idea is that eventually we'll take this idea out of the box and you are able to move your affected limb pain-free, all right? So there you have it. Good luck with your mirror box therapy, and we'll see you in a few months.